The Department of Health and Human Services characterizes underserved communities to include members of minority populations or individuals who have experienced health disparities. The elderly can fall into the underserved category based on if they receive fewer healthcare services, encounter barriers to accessing primary healthcare services such as economic, linguistic, or cultural factors, have a lack of familiarity in the healthcare delivery system, or face a shortage of readily available providers. Since 1 in 3 elderly adults are economically insecure, the rising costs of healthcare can contribute to seeing this population categorized as underserved. Advocacy and collaboration are ways to ensure the elderly are better able to access occupational therapy services. As occupational therapists, we can assist in setting up access to community programs in conjunction with other services to ensure the elderly are being set up for success as they age. One program that would be beneficial for communities may involve pairing occupational therapists with local senior center staff to set up assistance during open enrollment with Medicare. The collaboration between an elderly adult, Medicare representatives, and an occupational therapist would address the challenges the elderly adult faces, which can include a lack of familiarity with Medicare plans, which plan is economically feasible, or using available and evolving technology to enroll in available plans or set up payment options correctly. This program can reduce health disparities the elderly may face.
62% of Americans over 65 have more than one chronic condition, which can impact performance skills. Performance skills, or observable functional actions with purpose, encompass multiple dimensions that require occupational therapy intervention. The 3 components of performance skills include motor skills, process skills, and social interaction skills. Loss in sensation due to diabetes or arthritis are examples of how motor skills can be impacted. Processing skills refers to the ability to carry out a skilled task. For example, an elderly person may be able to physically use a saw blade but cannot initiate or sequence the task independently. Social interactions require appropriate gestures, clarification, and timed responses. An elderly person with dementia, depression, or poor motor control have difficulties in communication. The elderly population may have difficulties signing up for their benefits due to poor performance skills.
When you think of performance patterns, they are broken down into 4 sections that are habits, routines, roles, and rituals that are used in a process of engaging in occupation or activities. The elderly population performance patterns may vary depending on the individual's level of health, culture, family routines, and environments. Habits are behaviors that are performed automatically without any thought, such as when waking up, you brush your teeth, or you eat breakfast daily, and even washing your hands after using the bathroom. Routines are a step further than habits, involving having a structure and steps that are done daily. Some common routines that the elderly population may participate in is when waking up and sleeping at specific time, taking medication, taking naps, watching a favorite show on television, afternoon bingo, and even maybe taking a walk. Rituals are symbolic actions with spiritual, cultural, or social meaning that one engages in. Some examples of rituals that the elderly population may engage in are birthday parties, family reunion, prayers, or any other form of celebration. The elderly population may have many roles that they fit in, such as being a spouse, aunt, uncle, grandparent, or friend. These performance patterns that the elderly population has formed throughout the years can be affected in many ways, such as age, dementia, physical ability, chronic disease, and even in their environment. As OT practitioners, we must be able to understand and distinguish each individual's performance patterns in a system according to their needs.
This rapidly growing underserved population is expected to nearly double by 2050 and can be faced with a multitude of environmental and contextual challenges. These challenges are evident in the physical, social, socioeconomic, and virtual contexts as this population transitions into later stages of their lives. Many of these transitions may include drastic changes to their physical environment, including giving up their home to live in a long-term facility such as assisted living, nursing home, or continuing care retirement communities. The social environment becomes increasingly difficult for this population due to the loss of friends and spouses, which results in feelings of isolation and loneliness. Social economic status plays a major role in the ability for this disadvantaged group to access resources that enable them to participate in occupations. Sparse access, performance skill deficits, and limited knowledge due to the generation gap results further in the difficulty of allowing this population to engage in necessary occupations that require technology. It is apparent that as we age, the changes to our environment and context will play a major role in our quality of life and ability to engage successfully in the world around us. Occupational therapy encompasses a wide scope of practice in this disadvantaged group. Specifically, OTs assist in providing care for elderly who have a variety of conditions such as visual and hearing impairments, as well as mobility limitations. Education with fall prevention, energy conservation strategies, and compensatory techniques are a few examples of how the OT profession can assist this group facing physical and cognitive barriers in their environment to improve quality of life and overall well-being.